morning, everybody. This is Heather Thomas with the Joint Information Center for Snohomish County's response to COVID-19. I'm going to take just a couple minutes to click buttons to make sure that all of the media have joined us have permission to record. As always, you will have permission to record this briefing, and we are also recording, and we'll have that available on our website and YouTube channel later today. So give me just a moment. We've got a full house today. Almost done. Okay, I believe I have given everybody permission to record, but if I missed somebody, please send a message in the chat box to the Joint Information Center and I will get that fixed for you. We're joined this morning by Snohomish County Executive Dave Summers and Snohomish Health District Health Officer Dr. Chris Spitters. After each of our speakers have shared an update, we will take questions using the chat feature. Please make sure to submit your questions to everyone so that all of our speakers can see. Thank you again for joining us. And with that, I will turn it over to Executive Summers.
Thank you, Heather, and good morning, everybody. Thank you for joining us. Just wanted to talk a couple of minutes about the really amazing and strong partnership we've had between Snohomish County government and the Snohomish Health District. When we went into this COVID crisis about 2 years ago, we were all extremely fortunate to have two very extraordinary leaders at the helm of the Health District. One was the Health Administrative Officer, Sean Frederick, and then our Health Officer, Dr. Chris Spitters. And I could not be more grateful for the partnership we've had in the team. There we go. Same with Benelli. You know, we've had to make really thousands of decisions over the last year or two, yeah, big and small, but you know, whatever the decisions, Sean and Dr. Spitters have really approached them with thoughtfulness, professionalism, and just the very best interests of our residents as their top priority. So, as you know, Dr. Spitters will be retiring. Fortunately, he'll be with us till the end of June. But Doctor, I just really wanted to say how grateful I am for the work you've done. I know it's not been easy. The public health officer really has been at the point of both public interest and attention, and looking to you for advice. And I've watched you with great admiration really balance your deep understanding of the science and the medicine behind COVID, but the science and medicine, which tells you one thing, but also the human interest and the human needs and concerns that our public has felt about everything from masking to vaccines, and the impacts on both individuals and their families, but also our businesses, and watch you balance those things. And I just admire you greatly. This is not a good day for media. Sorry about that. But just want to say thank you, and I'll miss you. It was very sad to hear you're retiring, but happy for you and your family. I just wish you the very best. You've earned some time to reconnect, and I just think and wanted to say on behalf of all the residents of Snohomish County, thank you. You've been our doctor, and very much appreciate that. So thank you. With that, I'll turn it off to Dr. Spitters. Thank you.
Okay. Well, thank you, Executive Summers. It's been, you know, we met over COVID, and it's just been a track meet since then, but I can't imagine a better partnership between the Health District and the county than what we've had with you and your cabinet and DEM and Human Services. We've really just been fortunate have that. And I've been very lucky to have not only Sean, Frederick leading the team, but the whole team behind both of us, supporting us. So, the respect and admiration is shared, and we've got a little while to go here, so more work ahead. But I thank you for your acknowledgement and well wishes, and look forward to more in the months ahead. Hopefully, with an improving forecast for all of us in Snohomish County. So with that, speaking of Snohomish County and COVID, I'm going to skip over to the update on numbers. Our total number of cases for last week did increase from 1,140 the prior week up to 1,310 cases for the week ending Saturday, November 5th. Excuse me, Saturday, December 4th. Our 14-day case rate for Sunday, November 21 through Saturday, December 4 dropped again slightly to 290 per 100,000 residents. Typically, it's unusual to see the number of cases going up and the 2-week rate going down. But if you look over the past several weeks, the case counts have been up and down a little bit. And so that 2-week figure is an average across 2 weeks. So the ups and downs have contributed to that. But needless to say, we're not seeing dramatic declines in case rates over the long run. Over the long run, it's been a steady, slow decline with some ups and downs. Certainly, the increase last week does raise the question of whether holiday celebrations contributed to that. I think time will tell, but an increase like that of almost 200 cases during the week following Thanksgiving is certainly suggestive of a holiday connection. But we'll just have to see how that pans out over time. Fortunately, there's no significant worsening of the ongoing impact on the hospital systems, which currently have 51 COVID patients in beds, 17 of whom are in respiratory failure and on mechanical ventilation. On the vaccine side of things, demand continues to remain high for both pediatric doses among children 11 years of age and under, and or children 5 to 11 years of age, and for boosters among adults. Data on vaccination through Saturday, December 4 shows the following. 22% of 5 to 11-year-old children have initiated vaccination. That's more than 16,000 of the 75,000 such children in the county, and 6%, or 4,500, are already fully vaccinated, got both doses. This means that 74% of the county's total eligible population over the age of 5 has had at least one dose of vaccine, and 67% are fully vaccinated. Looking at a little bit finer age cuts, if we look at adolescents, ages 12 to 15, 60% have started and 54% have completed. And when we look at older age groups among adults, the completion of vaccination ranges from 70% among those 16 to 19 years old up to 82% among those 65 years and older. More than 125,000 people have received their booster or additional dose, with around 30,000 of those given in just the last 2 weeks. Now for a few comments on the Omicron strain of COVID. The Washington State Department of Health, in partnership with the University of Washington's Medicine Virology Lab, has confirmed a total of 3 cases of the Omicron variant found in cases from Thurston County, Pierce County, and King County. While not formally identified in any Snohomish County specimens yet, it is likely that if it's in the Puget Sound region, it's also here in Snohomish County. Things worth noting are that early work from South Africa, where this strain was first detected several weeks ago, suggests that it is transmitted much more rapidly than the Delta strain. repeat infections are more common than with Delta. That is, prior infection seems to be a little less protective with the Omicron strain than with Delta. The impact on breakthrough infections or on vaccine-acquired immunity remains to be determined, but given these findings so far, we wouldn't be surprised if we see more breakthrough infections than we have with Delta. While there's no strong signal of an increase in disease severity, the illness associated with Omicron coming out of South Africa, the book is still open on that, but again, no strong signals that that's the case. Many epidemiologists, modelers, people involved with the Omicron strain believe that it will indeed replace the Delta strain rapidly in coming weeks and months. Work is ongoing to determine more about disease severity, transmission, and the potential for or extent of escape from prior infection or vaccine-acquired immunity. Now, having said all that, there's a lot we don't know about Omicron, but there is a lot we do now know about COVID in general and how to prevent it and prevent transmission and prevent the severe consequences. So let's just keep putting those tools to use. Whether it's Delta, Omicron, or a future variant. We need to just keep doing what we're doing, but maybe a little bit better in some areas. Getting vaccinated is the best way to prevent COVID or its consequences. We still have 200,000 eligible individuals in Snohomish County who haven't started, and another 60,000 under 5 years of age who aren't eligible yet. So we want to work on getting vaccination coverage among those eligible higher and get everyone their boosters as well. If you're eligible for a booster, go get it. Wear a mask consistently and correctly, especially when in public indoor spaces. Optimize ventilation in indoor spaces. Air moving through and out carries virus with it. Better ventilated places are lower risk for COVID transmission. Reconsider attendance at large gatherings. Pursue testing when you have symptoms. Stay home when you're sick. You open up your cell phone to WA Notify. That's the digital contact tracing system. And stay tuned for more information on this and more news about Omicron as we're learning more every day and the situation is evolving. And so with that, I'll turn it back to you, Executive Summers.
Thank you, Doctor. First question is, given the demand, how many vaccine doses and how many booster doses did the county receive last week? And how many will be coming this week for vaccines and boosters? Also, are any healthcare providers such as Providence not giving booster shots?
Okay. So first, the vaccine accounting is not divided up where it's real clear to us at the front end about how much of the supply is dedicated for boosters, and more just providers order a supply and then administer it depending on the reason, whether it's a first dose, a second dose, or a booster. Having said that, we've seen a strong increase in the number of people total being vaccinated, that a number of vaccine doses administered per week in the county have increased from about 10,000 2 months ago. Now we're up to 25,000, 30,000 doses a week. Again, most of that is boosters. I would say through the health district sites, I believe it's 75% of doses going out are boosters. And then most of the rest are in the system are pediatric vaccines. There's a few people getting a second dose and very few people starting. That's the best I can give you in response to your question. Regarding individual providers, I haven't monitored that tightly which providers are ordering doses or providing them, but I think that there's ample supply out there between the healthcare system and or ample venues between the healthcare system and the pharmacy system. Having said that, especially for people trying to get boosters right now because demand is high, or children ages 5 to 11, There's just simply more people interested than there are slots in the system. Vaccine supply itself is not the rate limiting step. It's really the number of administration slots that people have open. Maybe with the kids, it's a little bit of supply as well, because that's only coming in at about 5,000 to 6,000 doses a week. So that's all we can get done in the county. That's my best answer to your question there.
So, Doctor, of the 200,000 individuals who have not started vaccinations, do we know where they live, and are they concentrated in particular parts of the county, or do we have that distribution information?
Well, we do have a vaccine coverage map that you can see on our website, and the general trend is that as you move from the zip codes, it's the map on our website, and the way we calculate it is by zip code. And the highest coverage rates up in the 70s to 80s are generally at the south end of the county. And then as you move north and move east, things decline 10 to 20 percentage points, especially as you move farther from the urban core.
Okay. If Omicron is detected in Snohomish County, can residents expect to hear the news first from Snohomish County Health District or the State Department of Health?
Well, I honestly can't answer that question. I think likely the State Health Department would contact us, and we'd coordinate how we're going to communicate it. But one way or another, you'll find out when it comes. Again, hearkening back to my earlier comments, it's likely already here. It's just a question of time until it gets detected in the genotyping surveillance system.
If I remember the coverage right, both Pierce County and King County have had detected cases, so likely here in the region.
Likely here, yeah.
Well, let's see, how are we doing on school outbreaks?
Well, the September was the peak month, and I don't have a specific number for you, but I think that we've still got many buildings with cases and ongoing activity with the schools, but it's slowed down a little bit since September, early October, and hasn't really picked back up. And as we move deeper into December, we'd expect naturally kids going home for the winter break. That will interrupt any transmission going on at the schools, and buy more time for the vaccine effort to proceed, which, although the kids aren't in school, they can continue to get vaccinated.
Executive, you're muted. Sorry.
I think that's probably the first time that's happened in 2 years. New York City has begun limiting access to some indoor venues like fitness centers to only those with vaccinations. Are you considering imposing any similar limits locally or requesting state health officials to do so statewide?
Well, I'll speak to this a bit, and feel free to chime in, Executive Summers. We've given it consideration, and there are a variety of pros and cons to the approach. And thus far, we have not elected to initiate that in Snohomish County. I don't think there's been much of a change of thought in that direction at this time.
I'd agree with that, and we've looked at that issues with a number of businesses and don't have any plans to impose those. And, to your last point, Doctor, I think it was yesterday we were discussing this with the health district, and one of the graphs I saw, a lot of the new cases that are detected are really with the youngest age group. And that was kind of the first time that I remember seeing them really leading the numbers as an age group. It was new cases, and so it seems like with schools open and that sort of thing, that we are seeing transmission in the younger population, but don't really see any indication, at least I haven't seen any, that would warrant us to consider further restrictions on businesses at this point. That's my feeling about it.
It's absolutely right. The case rates in the younger group, 0 to 14 years of age, are lagging behind. The declines in the older age groups are clear, and it's really the younger age groups that we've seen kind of go sideways over the past several weeks.
What's your expectation about cases turning back upward for winter as more people get vaccinated? Have you given much thought to whether Omicron might change that dynamic?
Right. Well, you know, as people move indoors, here we are in the cold weather, and it's going to be that way for a few more months. So more time spent indoors means greater risk, but with appropriate prevention measures like vaccination, masking when you're around people who aren't in your home, especially if there's unvaccinated folks in the crowd, and then keeping spaces well ventilated, we can really mitigate that. On top of that, there's the concerns about a winter flu surge that, combined with COVID, could put our healthcare system back on the brink again. So these are all real concerns, some or much of which is in our hands to control, and we'll just have to see how that goes over time. And certainly we're all interested in what the impact of the Omicron strain, as it presumably becomes more widespread, will have. I think I wouldn't be surprised to see more breakthrough infections based on what we're hearing from South Africa about an increased risk of reinfection with Omicron in people who were previously infected. We don't have data yet on, looking in the test tube at how well antibodies from people who have been vaccinated bind to the Omicron strain, but that kind of work is underway. And then we'll see as time passes. But I think in the meantime, getting vaccinated is a good idea. It's worked, there's the immunity afforded by the vaccine thus far has worked well against all strains, even Delta. And then for those of you who are fully immunized, going ahead and getting that booster as soon as you become eligible to raise those antibody titers are an additional protective measure as we wait and see how this all pans out with Omicron.
Any further questions?
May I make one additional comment, Executive Summers? I just wanted to remind folks, there's so much interest in the Omicron variant, and we mentioned people being detected with that. I have to remind folks that testing is not the regulatory framework under which that testing occurs does not permit results to be for strain typing to be given to individuals. It's not approved for that use. It's really a surveillance tool. So people should not be, there is no Omicron test to pursue. If anyone advertises that to you, it's false. And then public health, when we do that surveillance testing, the regulatory framework under which we work doesn't allow us to release that result to your healthcare provider or to you. It's really a surveillance tool for us to get an idea of what's going on in the community, but it doesn't impact the knowledge of any individual.
Another question, given the spread of cases among children, why is there not more serious discussion of temporarily closing schools and returning to remote learning, even for winter?
Well, I don't want to get out ahead of our educators, who ultimately are in the absence of a, clear and convincing case to the contrary. It's really in their hands, and they have to balance these concerns that you raise, which are, carry merit, along with the impacts on the children's education, social and emotional development, other services they get at school, and the impacts on the family at home. And thus far, although we do see a lot of cases in 0 to 14-year-olds, It's not like every case amongst them was caught at school. In fact, the numbers of cases that occur in school outbreaks are generally less than half a dozen. Half of the time, they're less than half a dozen. And even though there's about 1,000 kids in quarantine in Snohomish County schools, that's about 1% of the total school population. So the other 99% of kids are not being affected by either transmission or quarantines. And so, the risk benefit on that kind of thing, now knowing what we know, much different than say back in March or April of 2020, I think that it's a reasonable thing to continue operating the schools with the safety measures in place, move forward with the vaccination effort, and work to keep our kids and the school communities as safe as possible, knowing that some small amount of transmission is still going to occur.
Have there been reports of fake strain tests?
Not that I'm aware of. No, not that I'm aware of. I got one marketing email, though. This is the kind of thing saying, "Oh, hey, Omicron's out there, and it's out there, and it's very important to detect. So we have this test to sell you for detection of COVID." So it's a subtle. That one would be an example of a subtle misrepresentation of their product. That they didn't explicitly say they were offering Omicron testing, but they implied it, and it's not true. That's the kind of thing I'm suggesting. But certainly, if anyone explicitly says they have Omicron testing to offer, you should question that and run that by your healthcare provider.
No, Dr. Spitters, I'm sure I'm not alone in wanting to thank you for all you've done for us during the pandemic and beyond. When can we take you to dinner?
Well, I'm a public servant, and so this is, the privilege to serve, and is my compensation. I'm really grateful for your appreciation, and but we can leave it at that. Thank you.
All right, this is Heather Thomas in the Joint Information Center. We'll go ahead and wrap up for today. Want to thank everybody for participating in their questions. Just a reminder that we have moved to every other week. So the last media availability briefing for the year will be December 22nd. So stay tuned for updates on that. Thank you all and have a great day.
Thank you.